Welcome to the show discussing problems and issues of health with Dr. Alcena. For this segment, I'm going to continue to talk about stroke. Stroke is a very, very common problem. Worldwide, you got some 12.7 million people have a stroke every year, secondary with hypertension. Altogether, 15 million people have stroke every year across the world. In this country, 795,000 people suffer a stroke, and of that number, 600,000 of these strokes are new stroke, and 185,000 are recurrent stroke. This is a very serious problem. Every 53 seconds in this country, somebody is suffering a stroke, and every 3.3 minutes in this country, somebody is dying of a stroke. Altogether, 7 million Americans have had a stroke so far. Now, what you got to understand is that worldwide, 5 million people die of stroke every year. This is a serious problem. And there are, of course, reasons for the different types of strokes. The number one cause, of course, is hypertension. And stroke is more common in women than it is in men, and stroke is more common in minorities, men and women, than it is in Caucasian men and women. And in this country, there are different states where strokes are more common. The so-called stroke belt, which consists of Alabama, Arkansas, Georgia, Indiana, Kentucky, Louisiana, Mississippi, North Carolina, South Carolina, Tennessee, and Virginia. These are called the 10 southern states where the stroke is most common. And of course, this is mostly associated with poverty and racial discrimination, stress, and all the rest of it. Okay. Now, there are different types of stroke. By the way, this chapter in my hand is 20 pages, and it came from this huge textbook that I wrote 2 years ago, The Heart and Practice of Modern Clinical Medicine. I wrote this in 2016, 136 chapters. Now, if you can get your hand of it on that book, then of course you will be lucky and you'll be up to date. Now, there are different types of stroke, as I started to talk about last week, and I'll go back here and start listing them for you again so that you have an idea the different types of stroke that exist now and throughout the world. You have ischemic stroke, 61% of all strokes. Lacunar stroke, 20%. You have embolic stroke, 24%. Then you have hemorrhagic strokes, about 10%. Then you have ruptured aneurysm, bleeding from AV malformation, transient ischemic attack, subarachnoid hemorrhage, 7% of all stroke. Then you have occlusion of the coronary arteries by plaque, causing stroke to occur because of lack of blood flow to the brain. Now, I brought with me a man-made version of the heart to show you. We talk about atrial fibrillation being a very common cause of stroke as well. And I want to take some time to explain that to you. This here is a chamber of the heart called the atrium. See that hole there? That's the atrium. Now, when one's blood passes through there, and it gets processed and go to wherever it's supposed to go, and it goes to the brain or all over to perfuse the body with blood and oxygen. Now, atrial fibrillation, if when something happened to the heart, and the something could be many different things, that causes the atrium to start beating on its own, separate from the rest of the heart. That's called atrial fibrillation. And at that point, the atrium has a worm-like movement to it. Worm-like movement, and that then is the predominant beating part of the heart. The heart is to beat in a regular fashion, lap, tap, lap, tap, lap, tap. That's coming from the ventricle. However, when the atrium is malfunctioning, then the heart rate is irregular. And when it becomes very, very fast, it can lead to a whole host of problems having to do with the heart. It can cause a heart attack, it could throw somebody into congestive heart failure, and it can, in fact, lead to death. However, every single individual who suffers from atrial fibrillation, every now and again, when the atrium is supposed to be like that, if it stays like that permanently, there's problem, but the problem has to do mainly with the heart, and it won't interfere with the brain, okay? Like this. Except, of course, if it's going too fast, somebody can collapse or whatever. Now, what happens is that everyone who suffers from atrial fibrillation, every now and again, instead of the atrium keep doing that, the heart keep pumping like that as well, intermittently. That's where the problem is. So when the heart is doing this, because the heart is moving in a worm-like fashion, that then allow platelet plug to sit in there. Because when the heart is moving in the worm fashion, the platelet plug stay right there. Platelet aggregate and sit right there. The little plug of platelet sits right there because the heart was not pumping properly. Now, the reverse is that once the heart starts pumping normally, intermittently, those plugs get dislodged. The normal pumping of the heart dislodges the platelet plug and shoot it to the brain, and you have a stroke. That's what happened. Now, that's why when I get to talk about treatment, I'll mention the fact that why aspirin is such an important part of the treatment of atrial fibrillation to prevent stroke, because aspirin prevents platelet aggregation. That's correct, because aspirin is an antiplatelet medication. Of all the fantastic things that aspirin does, one of them, of course, is prevent the platelet plug from forming. It disaggregated. So therefore, the platelet plug cannot sit here waiting to be shot to the brain. The aspirin would dislodge it. However, we have other form of things that can cause somebody to have atrial fibrillation, and because of that, sometimes aspirin is not the appropriate medication, such as, for instance, if somebody start developing atrial fibrillation because they have a valvular heart problem, well then, in this case, then one has to be careful because the aspirin may not be the proper medication. That is why now we have all these medications out there, Eliquis, Xarelto, all of them. They're fantastic medication. They're factor 10 inhibitor, we call them. That then will cover all aspects of abnormality that causes atrial fibrillation, period. It doesn't matter whether it was a valvular or whether it wasn't, because once the blood is thin, that thinness of the blood will prevent the platelet plug from aggregating in here and shooting into the brain. That's why these medications are so good to prevent stroke secondary to atrial fibrillation. Now you understand that, okay? Now you see, I just read you the list of things that can cause, of course, ischemic stroke being the most common. That makes sense because we have a tendency as human beings to suffer from ischemia for one reason or another, in particular ischemia of the heart. And once you suffer from ischemia of the heart, you suffer from you could have a whole lot of problems, but you could also have ischemia of the brain. That is ischemia of the vessels in the brain that then prevent oxygen from being delivered properly, and then the area that is starved from oxygen and blood can develop a stroke because of lack of blood flow and oxygen to that area. Okay? So that's why, because that's being so common, and it's all because the most common reason for it is hypertension. You say, well, how do you go from hypertension to ischemia of the brain causing a stroke? I explained that last week. I'll explain it again. The blood vessels, the arterioles, the arteries in the brain, in particular I'm talking about. It could be arteries anywhere, but I'm sticking to the brain. were not made to withstand elevated pressure. They were not made for that. So once the pressure becomes elevated, the first lining of a blood vessel is called the intima. The fact that the pressure within the vessels uh, is elevated, that itself causes an aberration to occur because of the first lining of the vessel, of the blood vessel. Once that aberration occurs, then you have debris that are passing through that's supposed to pass freely because the first lining is supposed to be nice and smooth. Then the aberration causes a nidus. A nidus is the first garbage that gets stuck on the lining of that vessel. That then, the second one that comes in, the third one, they're all piled up. Then you have a local inflammation that occurs. That local inflammation then lead to the formation of plaque. You can't have plaque formations anywhere without first having a local inflammatory process. Now you understand that. But the local inflammatory process begins because the vessel, that a particular area, becomes abnormal because the pressure within that vessel is too high. That's how, let me repeat, you cannot get plaque formation anywhere in the body without first having a local inflammation to develop. How about that? Okay? And once the local inflammation develops, then plaques begin to form, and then the vessel becomes narrower, narrower, and narrower to the point where blood cannot pass through freely, and the area of the brain that this particular vessel is responsible for to carry blood to is starved from blood and oxygen, and that area develop ischemia, and then you could stroke in that area any moment. Blood pressure is so common. In this country, 1 out of every 3 adults suffers from high blood pressure. And 1 out of every 2 African American / black folks in this country suffer from high blood pressure, making it the #1 disease really in this country. And to make matters worse, the bulk of it, frankly, is not being treated properly. More than 50% of folks with hypertension are not being treated properly for that blood pressure for a variety of reasons. Part of it is lack of knowledge of those that are providing the care, and part of it is patient preference, not wanting to be treated with the appropriate medication because it's bothersome to them, because you can't treat blood pressure properly. You could treat it, but you cannot treat it properly, as I mentioned last week, without taking a thiazide diuretic. So if you take a look at the step ladder, the first step in the treatment of high blood pressure to be treated properly, and you have to understand, 97% of all hypertension is due to essential hypertension. 97%. The other 3%, I'll have occasion to talk about another time. So therefore then, since the basis for essential hypertension is salt retention, followed by water retention, followed by extension of the intravascular system, causing the pressure to go up. That's it. So therefore then, you must first, if somebody presents to your office with the blood pressure that is not excessively high, but high enough, the first thing you will do is give them a thiazide diuretic. Thiazide diuretic happens to be the cheapest medication to treat blood pressure. $7 thereabout for 30 pills for the month. Thereabout. Very cheap, but it is the most effective. Now, if that's not sufficient, then you could add a second medication. That's where the argument comes in as to which ethnic groups is to be given what the second medication. Yes, there are differences, no question about it, but the first difference is the same. And I mentioned last week, before my hair became gray, years ago, I came up with this idea that there had to have been a gene located somewhere in the human body that allowed people way, way back in ancient Africa to remain alive because of the ambient weather, hot condition that exists there. There had to be a reason why the people were able to hold on to enough salt, hold on to enough water that prevent them from collapsing and dying of dehydration. I came up with that idea from the top of my head and published that, and from there the rest is history. This was then picked up by the powers to be, people who have money and power at Georgetown University, University of Virginia, and a few other places, I'm sure, where they decided to actually do the research. They had kidney specimens from Caucasian American, kidney specimen from Japanese American, kidney specimen from Black American from Ghana. And they grind these three separate kidneys and sorted out their DNA. And sure enough, they found a gene called G protein coupled receptor kinase type 4. You can't make this up. In the same quantity, in the same quality in all three ethnic groups. As it turns out, all human beings, regardless of what you think of yourself, what you look like, if one look at your kidneys, DNA, you have G protein coupled receptor kinase type 4 in that kidney. And that is an African inherited gene that all human beings has. How about that? And this was published last week, I forget the journal. This was put in the proceeding of the American Academy of Sciences in 2002. I remember that now. I forget the actual journal last week, but it was in the proceeding of the American Academy of Sciences in 2002. I think they just changed their name now for whatever reason. So that's when it was published. And subsequently, studies was carried out using rats, I think, at Yale, proving the same thing. So therefore then, in 2007, the JNC7, which was the commission that supervises hypertension in this country, changed the whole landscape, how to treat hypertension, making water pill, i.e. diuretic, number one. And subsequent to that, the Anglo-Scandinavian study that involved England and Scandinavia had hundreds of thousands of people, because over there, the government control the medication these people get because they pay for it. So they have access to hundreds of thousands of data, and they evaluate all the patients that were taking different medication, calcium channel blocker, beta blocker, ARBs, and diuretic. Only the patients that were receiving diuretic, and turns out on calcium channel blocker thereabout, and some of them with ARB, that did well in terms of stroke, marked decrease, heart attack, marked decrease, congestive heart failure, marked decrease, and death, marked decrease. This is serious business. The Anglo-Scandinavian study subsequently proved that. So the water pill is indispensable in the treatment of hypertension. Now, if you don't want to take it every day, sometimes you could take it 3 times a week, and the doctor can address it for you. Remember, the title of this book, The Art and Practice of Modern Clinical Medicine. Clinical medicine cannot be practiced using protocol. Protocol is used in doing research, which I'm very familiar with, because as a medical technologist, I did research myself. Okay? So therefore then, if you're going to treat somebody to control their blood pressure, you have to do it properly. It's the patient comes to you. If the patient doesn't come, there's nothing you can do about it. If the statistics is brutal in terms of how poorly people's blood pressure are being treated. Recently, this year, the cardiologist group came up with a change in the blood pressure thing, so that it used to be like 140/90. Now they change it to cause hypertension if you have like 130/85, blah, 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 blah. I don't quite buy it, but who am I? They have power, I don't. But I have the advantage of the knowledge, plus I'm treating these folks. So therefore, then, I'm saying to you, that's the number one cause of all types of stroke. 61% of all stroke is because of untreated or poorly treated elevated blood pressure. And it is so simple. I mean, you can't find a disease that is easier to treat than hypertension if you understand, if you take the time to really learn this stuff and pay close attention to it. The second group of folks that when the ethnicity has to be played in is, of course, the second medication. You can't give a non-Caucasian person an ARB to treat blood pressure. It's not going to work because the ARB goes so far. It doesn't go all the way to the end of the renin, angiotensin, aldosterone system. You could do it for a Caucasian person. That's when you have to know the ethnicity of the individual. You have to be sensitive to it so that you know what medication that is appropriate for a minority person, what medication is appropriate for a Caucasian person, and what medication is appropriate for all of them. Anybody will respond to a calcium channel blocker. It doesn't matter what ethnicity you are. Anybody will respond to an ARB. It doesn't matter what ethnicity you belong to. But you can't take, if you were to know how many times over the 40 years that I've been practicing, I've seen black folks walking into my office that I agree to see with blood pressure. I had a patient earlier this year that showed up in the emergency room here in White Plains. His eye doctor was smart enough to take his blood pressure because he went there. He was with headache and eye problem. Blood pressure was sky high. And yet, he was seeing a physician regularly. But he wasn't getting the appropriate. This is not criticism. This is facts. Then a wife called me, had to rush to the emergency room and took over this man management of blood pressure. Now his blood pressure is 110/70. I mean, give me a break. It happened again last week. I had to rush last Wednesday to the emergency room for somebody, blood pressure. You can't make these things up. This is 2018, my folks, and people are not listening. They're not listening. I'm not here to criticize anybody. Nobody knows about physician than I do. I'm a teacher. I'm an academic doctor. I spent 40 years of teaching doctors and residents and intern and whatever. I know the behavior. I know everything, inside out. That's what I've devoted my career to. But for crying out loud, I don't have a monopoly to this stuff. This stuff is out there. It's in this book. It's in over many other books. Why it's still going on, I don't know. I can't fault the doctors. It's not my job because sometimes the patient don't listen. Sometimes the patient don't eat the proper diet. Sometimes they don't eat because of poverty, but even those who can afford it. We have situations where folks will tell you to your face they don't want to be treated the same way black folks are being treated. Now, how outrageous that can be. And because of that, some doctors don't want to get into that argument. They just, you want beta blocker? Here's the beta blocker. Even though beta blocker will do 0 for essential hypertension. Nada, 0, 90, it won't treat it. You couldn't go to the blackboard with the chalk in your hand and show me how a beta blocker will treat essential hypertension. Show me. I won't embarrass you, just show me. You can't. The mechanism is not there. And you got people are being treated with beta blocker for essential hypertension while the heart keep getting enlarged. Keep getting enlarged. The heart is a muscle. This is the muscle. The muscle keeps getting hypertrophied because it's suffering from the excess weight that it's feeling. The fibers of the muscles are stretching out until they can stretch no more. Bang, they go into heart failure. The number one cause of heart failure in young 40 to 45, 50-year-old African-American folks in this country is because of poorly treated hypertension. Now, you can't make these things up, okay? But the fact is, let's get back to stroke. So, now that you know all the different types of strokes that are out there, but you know the number one cause, of course, is hypertension. So we are going then to begin the process of evaluating somebody for stroke. But to do that, you have to first know something about the symptoms. And I'm not going to sit here and begin to bore you, because you will get up and leave, because it's 2 pages. You can't make this up. The symptoms that somebody can present with that can cause, that can make you suspect a stroke is 2 pages long. Okay? Okay? Let's talk about the risk of the stroke. Hypertension, diabetes mellitus, hyperlipidemia / high cholesterol, obesity. And you know, obesity is an epidemic throughout the world. Throughout the world. Metabolic syndrome, hypercoagulable state, primary polycythemia, essential thrombocythemia, kidney failure, sickle cell disease, atrial fibrillation, which I just talked about, cancer. But how do you go from cancer to stroke? I mean, give me a break. Most people with cancer, not all, most people with cancer will ultimately develop something called Trousseau syndrome. Trousseau syndrome causes you to have hypercoagulability. Once the blood becomes too thick, bingo, you could, in fact, sometime that's how cancer present. Somebody first present with a clot, either a DVT or a stroke. You treat them for it, you evaluate them, only to find out, and the underlying problem is because they have a cancer of one kind or another, and they have Trousseau syndrome, and that got them first. They didn't even know they had cancer. But once they stroke, then you evaluate it to find that. Okay, cigarette, tobacco smoking, Trousseau syndrome, which I was talking about, elevated lipoprotein A, elevated homocysteine, vitamin B12 deficiency, folic acid deficiency, low protein C, low protein S in the blood, decreased antithrombin 3, nephrotic syndrome, secondary polycythemia, obstructive apnea, taking birth control pill, taking estrogenic containing hormone, elevated antiphospholipid antibody, elevated circulating lupus anticoagulant, HIV/AIDS, factor V Leiden mutation. I'm going to stop here because the list is long. Next week, I'm going to continue with the list. It is incredible the different things that can cause somebody to have a stroke. And they may present to your office with symptoms like this. Listen, I'm stopping here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.